Hello, everyone. We'll be discussing Chapter 1. It is Introduction into Clinical Practice and Communication Disorders in the Rhea Paul book, Intro to Clinical Methods and Communication Disorders. Okay. This chapter is relatively short, and when we talk through this chapter, there is no lecture PowerPoint. I really just want to kind of give you an overview of what you should expect this semester with this course. So as of now, now that you're beginning to take CDIS 4200, you probably have already taken several courses in the department. And hopefully this has encouraged you that this is the profession that you are interested in. The clinical process course kind of brings in information from your other courses. This is accumulation. It's giving you information about what you're going to need to understand and to know for your clinical rotations in graduate school. And so as we talk through this course, you're going to kind of build off of a lot of information you've already learned in previous courses. And so I think that that's the cool part about this course, is it's really giving us and giving you an introduction into what you're going to be doing as a speech language pathologist or as an audiologist. It gives you hands-on practical application of what that means. You're taking the material that you've learned, maybe in clinical phonetics or speech and hearing science or language disorders course, in all of that information that you've learned, and now you get to kind of apply it to what that looks like in the clinical setting. So I hope you guys are as interested and excited as I am to teach you. And I kind of alluded to this a little bit in the syllabus review, but I want to just remind you, I hope that my passion in the field comes across in these videos. I hope that you can see that I absolutely love doing this job. I love teaching, and I also like being a clinician. I like seeing patients, making a difference in, I work with primarily pediatrics, and so making a difference in young kids' lives, and then their families and how that looks as far as a young, maybe 1 to 5-year-old who has a communication disorder, and how that communication disorder can impact the entire family. But I get to be a part of some small gains that we're making towards a difference for that whole family. And that's just really cool. I really enjoy that part of our profession. And so as you write your introduction, just a reminder, if you didn't see at the very end of the last video for the syllabus, I'm going to have you write a couple of things just to introduce yourself. Included in your introduction will be, why are you passionate about this field? What makes you interested in wanting to pursue a career as a speech language pathologist or an audiologist? And in that, I kind of want, you'll note on page 2 in the chapter, there's a list right here of different qualities. And I'm just going to kind of briefly touch on these. But I think these are some really good qualities that you should review. And as far as what is needed for our field as a speech pathologist or an audiologist. So the number one thing I think, and I agree with, it's listed first here, is a desire to help others. You're in this field because that's what we do. We help others. Your goal in pursuing a field in speech pathology or audiology, that will be what you do every day, is be able to help people. What an amazing opportunity for you to make a difference in someone's life by helping them communicate. Just an awesome gift that we are allowed to live out every day. It's really great. Now, when you are, helping other people, and you can you walk into the room with that patient or that client, just like I hope you can feel my passion for what I do as a teacher, an instructor, a professor, and as a speech pathologist. When someone comes to meet me and they're in my office for the first time, I hope that excitement and that enthusiasm, that passion and that drive, I really hope that is, that all of my patients see that and all of their families see that I'm just not coming to work for a paycheck. It is so much more than that. I am coming because I truly love what I do, and I know I can make a difference in that patient's life, whoever walks through my door. So anyone coming through your door to see you, whether it is your first day in graduate school, in your first clinical rotation, or when you're in your clinical fellowship, or your externship during graduate school, or an internship during graduate school, if you choose a school that has an internship, or your first day, once you've graduated, you've gotten your C's, you're done with your clinical fellowship, and it's day one you are fully licensed. Every patient that walks through the door should feel that enthusiasm. So that desire to help others is super important. And how do we do that? We need really good communication skills ourselves. That's what we teach. We are teaching others how to communicate effectively. And in order to do that, excuse me, we also need those communication skills. So things to take into consideration. I am currently in Southwest Florida. There's a huge bilingual population. I better understand the cultural differences in my patients and how what I say may or may not offend someone, whether or not I know or I mean to. And so learning different cultures based on where maybe you're working is really important to be able to communicate effectively and not offend anyone. It is, I think, really easy to do if you don't know the culture. And so, just keeping that in mind as you're, meeting new patients and they're coming from different backgrounds, just make sure to keep that in mind. So how you're presenting the material is appropriate. We haven't made it too childish for an adult, or we haven't simplified it too much that it feels like we're talking to them as a kid if you're talking to a geriatric population, or we're talking to a child that has expressive language delay, but their IQ and receptive language is within normal limits. So we don't need to talk down to them. We just need to help them communicate with maybe smaller words to start. So we really need to watch our social interactions, how we are presenting ourselves, both verbally and non-verbally, enjoyment and close contact with people, knowing that when I get to see kids in therapy, we are down on the floor, we are playing. I am wiping noses, and you are definitely in close contact with those people. Again, we talked about strong communication skills and social interaction, the ability to take pleasure in just talking. It is developing relationships both with your patients and their families are very important. And so just as important as it is for us to teach the patient or client how to communicate, it is equally as important to make sure that they are vested. They and their family are vested. I talked a little bit about that I can teach a 1-year-old in my session how to say a new word. But if I haven't taught that family how to then reduplicate that at home, how to generalize that skill in not my clinical setting, we're not going to see much progress. And so making sure that you're making those connections with families, figuring out what's most important to them, and how you can incorporate that in your session. I talked about in the syllabus video that I I had a dad once come to me, and we were working on some language um, goals. And I asked him if there was anything he was really interested in me targeting during therapy. What was most important to him? And his most important thing was his child was backing. That's where we take a front sound and we move it to the back. And so he said, I would really like my son to learn how to say the D sound, the D sound. Because every time we're in a grocery store, all I hear is gag, gag, instead of dad, dad. And it's really embarrassing. And that's what I would love. If you could do that, that would mean the world to me. Okay, so yes, of course I'm going to incorporate that. As long as it's appropriate for his age, that's going to keep the family vested. That interaction, that talking with the family is really important. We talk a lot about maybe the more administrative side of the speech pathology field. We do write reports, we do assessments and intervention and interviews and all of these things, but there are also the other part of our field of maybe calling patients and reminder calls and following up if they don't show. And one way I think it really helps working in private speech clinics, it's really taught me the power of investing in your families and connecting with them, and letting them know how truly happy you are to see them every week, how truly excited you are to see progress in their child, or them themselves if they're the patient. It really does allow that connection to happen, and you do see them more. They don't just not show up for therapy. If they can't come, they may reschedule versus just cancel. And so that also helps as far as continuity of care, seeing progress quicker because you're seeing the patient more. These are just little extra things, but these qualities are really important as a speech pathologist. Also, taking an interest in various processes when communication takes place. So, we definitely are talking about verbal communication, but we can talk about lots of different things. We can talk about signing. We can talk about using picture communication. We can talk about tone of voice, and rolling of the eyes or nonverbal communication, pragmatics, and all sorts of things. So those are all things that we're teaching patients, but we also need to make sure that we keep ourselves in check. Have you ever met someone that you can just read their face? They don't mean to be rude. My husband is one of them. I can see his face and I'm like, Dave, stop. Like, watch your face. I can see, you're trying to hold it in, but everybody sees how you feel. It is clearly across your face because you can't hide it. So just keeping those in check as well is really important. And a level of comfort being around those with disabilities. If you haven't been around a lot of people with disabilities, it can be uncomfortable because you don't know what's expected of you. You don't know what your role is maybe in certain situations. And so I find asking questions, asking appropriate, thoughtful questions can be helpful to families. So for instance, if you have someone in a wheelchair and it's a young child, and you could say, how are they doing with potty training? Do they need help going? Is that something I should come and grab you for? Just asking simple questions. Now, granted, I'm more focused on the child aspect because that's what I do, and that actually just came up the other day, but maybe there's some other things going on. Maybe there's a visual disability. And so asking the right questions, parents aren't going to be mad as long as you're asking in a very polite, thoughtful way. But, just being honest and saying, do you know, as far as visual, do you know if peripheral vision is affected? Is it, do they wear their glasses every day? I have often seen kids who are supposed to wear glasses and they don't to my sessions. And then I wonder, how much are they really seeing when we're looking at these pictures? And so asking parents questions can be helpful. Oh, I saw so-and-so didn't have their glasses on today. Do they not need them every day? Is it just for reading? And kind of following up. The more you are around people of different backgrounds, different abilities, I believe the more comfortable you will be. And so just know that these qualities don't always start 100% in everyone. They, I think, can progress over time, but just know these are important qualities to look for in yourself and to look in developing if you feel like maybe you're not there yet, okay? You'll also notice there's a lot of information as far as this text and what's expected. It talks about the American Speech and Hearing Association. It also talks about the information about your clinical competence, your certificate of clinical competence, also known as your Cs. I believe somewhere it talks also about the Council for clinical certification for audiology and speech. You'll see a number of standards as far as the program of study that starts on 1A. I'm not going to go through all of this. Just know it's good to kind of review. It talks about the code of ethics, information about implementation of different standards that it's looking for. But what I do want to go through is just kind of give you an update of what to expect this semester. So, as we're going through and we're thinking of all the different courses that you have taken so far, or maybe you even have a couple more you need to take, let's just kind of talk through what is the process that we're going through as a clinician, okay? And so as a student so far, you are learning, or you should be learning about what is normal and what is abnormal as far as communication. Where is that breakdown? What do we expect at certain ages? What would we not expect as far as voice quality, articulation sounds and when they're acquired, different language milestones, expressive and receptive, ability to follow specific directions, and for audiology, learning what an abnormal and a normal audiogram would look like. You are going to have a vast, depending on what you're interested in, you can have a vast array of ages of patients. You can have infants. You could have, infants, toddlers, preschoolers, school-age children, teens, adolescents, adults, the geriatric population. You could have a huge range of ages. And in graduate school, you should be able to hit most of those ages or at least a large majority of those ages in your clinical placements. Each graduate school is going to offer a little bit different graduate program and how it's laid out. One of the great things about ETSU is you have a different clinic every semester. And so in graduate school at ETSU, there are 5 semesters, 2 fall, 2 spring, 1 summer, okay? Each one of those semesters, you have a whole new clinic. A couple will be adult clinics, a couple will be child clinics, some will be on campus, some will be off campus. There's just a really good variety for you. You'll see some clients for speech-related delays and language-related delays and swallowing, maybe cognition and memory, all sorts of things. And so as a student coming into graduate school, what you should expect in a clinical placement is knowing beginning to understand what's the difference between typical or normal speech and communication, and then starting to get an idea of what looks abnormal, what does not what looks delayed as far as communication is concerned. And so as you're looking towards the future in graduate school, when you get a new client, a new patient, there's a lot of things to consider. So I'm just going to kind of go down the list and give you an idea of what it looks like when I have a new patient come to me. Okay, so a new client comes to me. I get a referral from the doctor. It usually says language delay. There's not much information there. So one of the first things I'm going to do when that client gets there, usually I see pediatric patients. So I'm talking to the parent, usually the mom or the dad, and I am interviewing them. So we're going to talk about interview skills this semester. How to ask questions. What type of questions do we ask? What are the most effective? And so I'm asking questions, and that's going to help me develop what type of assessments I should give that evaluation session. So clients coming in, they're coming in for an evaluation. I have the referral. I'm asking parents questions. I'm getting this interview process going. And those questions are help leading me to the correct assessments. As I'm thinking about assessments, I'm thinking about what assessments are going to work for this particular child's age, for their skill set, what they can do and what's a little bit more difficult for them, according to what parent has told me already. And so then I'm guiding my assessment protocol based off of what I know, what I want to know, and then what assessments I know will work for this age, and maybe skill set. There are certain ones I wouldn't use that would be a little bit more difficult for maybe someone who is severely delayed. And once you get through that protocol, what type of assessments will you use? Will you use standardized assessments, or will you use criterion referenced assessments? Will you use an observational assessment? Lots of different choices there. Once you finish that assessment piece, then you're going to, after they have left, so child and parent have left, you did the assessment, now you get into analyzing those results of the assessment. You score the assessment. You look through and figure out what does this information mean. I have scores. I know what their strengths and their areas of weakness are. Now, what do I do with this? So you're synthesizing all of this information from multiple different areas, multiple different types of assessments. You're kind of blending it all together and then writing up a report that's going to give you information and kind of one big or one small glimpse into what happened in that assessment. With your assessment, that's going, after you've analyzed the results, you're going to develop an intervention plan for that child. So when you're looking at that intervention plan, our goal is not to just say, you know what, I think minimal pairs will work great with this person. That's I like that one. It seems to work pretty good with kids. I think that's the type of intervention I'm going to use for this child who has a phonological disorder. Now, don't get me wrong. I love minimal pairs, but why do I use them? What is the evidence behind it? Is there research supporting minimal pairs? There is, by the way, but you need to know that. Is there a different intervention protocol I could use that would be more effective based on the child's age or the child's abilities or the child's error patterns? So there's lots of decision making happening. It's not just, okay, they need to work on K, I'm going to work on K. There's so much more than that. And so we'll talk through evidence-based practice. And, when you're developing an intervention plan, it's also really important, I think, to remember to incorporate the patient and the patient's family. What's most important to them? I talked about the dad and what was important to him and his child learning the D sound. So if you get parents involved like that, and even though you are working on the things that you think will be most beneficial for them, if you add something that the parent is really important to the parent, you will just get them on board so much quicker. Of course, it needs to be appropriate, and there's ways to kind of tweak information maybe they want with what you may have steps that lead up to what they want, because maybe what they want is up here as far as skill set, and we still need to build some baby steps before we get there. But the intervention plan takes a lot more planning than just, I see he had trouble with K, we're going to work on K. In addition, as you are doing therapy, so now you've did the interview, the evaluation, you've analyzed the results, you've developed an intervention protocol based on evidence-based practice, and then you're going to implement therapy. You need to be able to track that data. We need to know that this intervention is working. Intervention is constantly assessing. So even though I'm doing therapy and I'm teaching these skill sets, I'm still constantly evaluating and assessing. I'm using data collected every session. We need to know how to document. What does that look like? What are better ways to document than others? How much documentation do you really need? And what's too much? Or what is feasible given your caseload? Those are good questions to start thinking about. And so with documentation and measuring progress using data collection, we'll talk through that. And let's say over the few sessions I see, they're really declining here. I don't see an increase or an improvement in their skills. I actually see a decrease. Well, that tells me we need to try something different. Let's review what's happened in the last few sessions that's not working for this child. We need to regroup and then maybe try a different route. So you're constantly in this, monitoring progress to see, have they met a goal? Do we need to modify a goal? Is it too difficult? Do we need to add more support or take some away because they're doing better? Do we need to increase the difficulty level? So you're constantly weighing these things and thinking about them in your head as you're kind of chugging along in therapy. And then sometimes there are going to be things that come up, some ethical dilemmas. We're going to talk about some situations this semester and what would be the most appropriate way to respond to them. Things will come up that will make you think. And I think it'll be important that we kind of talk through some situations in which different ethical dilemmas will come up, and that may be a little common in certain circumstances, and how you should respond appropriately so you're not caught off guard if something happens, maybe during graduate school or during your clinical fellowship, or even when you already have your Cs and you're licensed. Things do come up. So anyways, as we kind of recap, this semester we're really going to be talking through normal and abnormal processes for communication. We'll talk about the interview process, interview skills, assessment, what goes into that, what type of assessments there are, developing an intervention protocol. Included in that, we'll also talk about how to make goals. And how to translate what we learned was a weakness in their evaluation, and then how to turn that into a trackable goal that we are able to track progress over time using that data collection, and what's the best way to collect data, as well as kind of review some information about some ethical dilemmas that you may face either during graduate school, your clinical fellowship, or beyond. Okay, so I hope this gives you a good little overview of the introduction. I'm really excited for this course. I hope you all are too. Have a wonderful night, and our next lecture will be on ethical principles next week. Thank you.